Hello, good morning everyone. So this is our 6th week. How are you this morning, class? Our topic this morning is all about different types of consumers. But before that, this is our objectives. Objectives: discuss the different types of Consumer Act. Identify programs for consumer welfare and protection. Distinguish the different types of consumers. Different types of consumers. Seasonal consumers are consumers who purchase and consume products on a seasonal basis. They shop at certain times when the need for them arises. Personal consumers are individual consumers who purchase goods for the sole purpose of personal, family, or household use. Organizational consumers are those who purchase products for organizations, governments, or businesses. Often, they buy in bulk and place long-term recurring orders. Impulse consumers are consumers who make unplanned buying decisions, immediately purchased when they connect with the product. Need-based consumers are re-consumers who buy goods and services when they need them and not any other time. Discount-driven consumers are consumers who purchase goods and services primarily for the discounts on offers. The Consumer Protection Act, implemented in 1986, gives easy and fast compensation to consumer grievances. It safeguards and encourages consumers to speak against insufficiency and flaws in goods and services. If traders and manufacturers practice any foul trade, this act protects the right as a consumer. The main motivation of this forum is to bestow aid to both the parties and eliminate long lawsuits. This Protection Act covers all goods and services of all public, private, or cooperative sectors, except those exempted by the central government. The Act provides a platform for a consumer where they can file their complaint and the forum takes action against the concerned supplier and compensation is granted to the consumer for the hassle or he or she has encountered. It aims to protect people against hazards to health and safety and deceptive and unfair sales acts and practices. Protection of consumers. International and national government regulatory agencies that protect consumers. Consumer Financial Protection Bureau, CFPB. It protects consumers from deceptive financial products, ensures consumers have the information needed to select the best financial services such as credit cards, student loans, and mortgage. Work with companies to eliminate fine print add-ons that can confuse and hurt consumers' finances, and helps consumers who are having difficulty paying their mortgage by putting them in touch with a counselor to help provide financial planning and assistance. Consumer Product Safety Commission, CPSC, responsible for consumer product safety, protect individuals from unsafe consumer products, take charge in evaluating the safety of consumer products, developing standards and conducting research as it pertains to safety. Federal Trade Commission, FTC, it protects consumers against false advertising and fraud. The most recent areas of concern have been towards businesses advertising to children. And Drug Administration, FDA, responsible for the safeguarding of public health by monitoring drugs, medical services, and cosmetics, protect our food supply, and recently published a list of online pharmacy websites that were selling fake drugs to consumers. National Highway Traffic Safety Administration or NHTES. It protects consumer by reducing death, injuries, and monetary losses through vehicle accidents. Play a huge role in the investigation to defect in motor design, equipment, and laws, and provides training to educate drivers about driving drunk. Securities and Exchange Commission or SEC. It protects investors, maintain fair, orderly, and efficient markets and facilities capital formation. National Agency for Food and Drug Administrations and Control or NAFDEC. It is federal agency under the Federal Ministry of Health that is responsible for regulating and controlling the manufacture, information, exportation, advertisement, distribution, sale, and use of food, drugs, cosmetics, medical devices, chemicals. Consumer Protection Organizations. Consumers International is the membership organization for consumer groups around the world. This is not for-profit company limited by guarantee, company numbers, and registered charity number. Government agencies, firms that we can approve to report illegal and fraudulent health products and services. The Department of Health or DOH, principal agency in the Philippines responsible for ensuring access to basic public health services to all Filipinos through the provision of quality health care and regulation of providers of health goods and services. Francisco Duque III is the head of DOH. The Department of Trade and Industry or DTI. This is the prime mover of consumer welfare in protecting the rights and interests of the consumers, committed to developing policies and programs aimed at sustaining the growth and development of the Philippine economy. Ramon Lopez is the current secretary. The Food and Drug Administration. This is a regulatory agency under the Department of Health mandated to ensure the safety, efficacy, or quality of health products. Of Consumer Protection in the Philippines. Republic Act No. 7394. This is the principal law for consumer protection in the Philippines. This anchored on the basic policy of the state to protect the interests of the consumer, promote his general welfare, and to establish standards of conduct for business and industry. Republic Act No. 3720. The act to ensure the safety and purity of foods and cosmetics, and the purity, safety, efficacy, and quality of drugs and devices being made available to the public, vesting the Bureau of Food and Drug with authority to administer. Republic Act 10611. Act to strengthen the food safety regulations in the country to protect consumers' health and facilitate market access to local foods and food products and for other purposes. Republic Act 1938. The established quality standards for food, drugs, medical devices, and cosmetics manufactured and sold in the U.S. and provide also for federal oversight and enforcement of these standards. These are the logos of Philippine government agencies to protect consumers. Consumer welfare, also known as consumer surplus, refers to the difference between what consumers are willing to pay and what they actually pay Consumer welfare refers to the individual benefits derived from the consumption of goods and services. In theory, individual welfare is defined by an individual's own assessment of his/her satisfaction, given price and income. Consumer protection is the practice of safeguarding buyers of goods and services and the public against unfair practice in a marketplace. Consumer protection measures are often established by law. Consumer protection is linked to the idea of consumer right and to the formation of consumer organizations, which help consumers make better choice in the marketplace and pursue complaints against businesses. Consumer protection is a group of laws and organizations designated to ensure the rights of consumers as well as fair trade, competitions, and accurate information in the marketplace. Consumer protection organizations. These are the advocacy groups that seek to protect people from corporate abuse like consumer protection agencies. The local, state, and territory consumer protection against, also called as consumer affairs, can provide us with information about our rights and options. They may also be able to help negotiate a resolution between you and the seller. Consumer welfare refers to the benefit of an individual from consuming goods and services. This may also vary from an individual satisfaction. Consumer protections, on the other hand, is the act of protecting the consumers from unsafe practice of purchasing goods and or paying services. Programs for consumer welfare and protection. Consumer Welfare Month, the Philippine Competition Commission or PCC is one with the Department of Trade and Industry or DTI and the nation in celebrating Consumer Welfare Month. The PCC remains steadfast in promoting competitions that result in advancing consumer welfare, which in turn resonates with one of DTI's mandate in pursuit of consumer protection. Deworming Program. The Department of Education or DepEd continues its drive to eliminate intestinal parasitism among the public elementary and secondary school learners nationwide through its mass deworming program or the Integrated Helminth Control Program in cooperation with the Department of Health or DOH. This mass deworming program aims to reduce prevalence of soil-transmitted helminthiasis or STH among school-aged children. If not treated, STH may lead to malnutrition, anemia, growth retardation, impaired cognitive functions, and other health problems. Implementation of School-Based Immunization Program. The Department of Health or DOH and the Department of Education or DepEd have implemented the School-Based Immunization Program as the government effort in the morbidity and mortality of school-aged children due to vaccine-related preventable disease. The School-Based Immunization Program is implemented through the provision of measles or rubella or MR and tetanus or diphtheria or TD vaccine to all grade 1 and 7 learners nationwide. The vaccines are provided for free and vaccination will be conducted every August as a routine activity of the program. As such, issuance of yearly memorandum is not necessary unless there are changes in the implementations of the program. School-Based Feeding Program or SBFP, the Department of Education DepEd, through the Bureau of Learners Support Services, School Health Division or BLSS SHD is implementing the School-Based Feeding Program or BFP for school years 2017 and 2022 to address undernutrition among public school children. Okay, any clarifications about our topic this morning? So if none, thank you so much for listening. And don't forget to visit our e-learning site www.gaitf.com/lcms. Thank you.